Hey y'all! Thank you so much for being here today at our virtual People's Hearing. My name is Mireya and my pronouns are she, her, and hers. I've been a Planned Parenthood volunteer for about 5 years now, and I first got involved when I was studying public health at the University of Texas, where I was notably interested in reproductive rights. Starting out as a young organizer, I received training and mentorship from some of the best people I know. Planned Parenthood Texas Votes helped me grow as a person and find my voice as a healthcare advocate. Now I'm passionate about getting other young folks in on the fight for reproductive rights in Texas. I'm honored to serve as the chair of the People's Committee here. Before you today, we are made up of current and former Planned Parenthood patients, advocates, and organizers. We are the people on the ground in community who are most impacted when the Texas legislature decides to cut funding and access to reproductive health and rights. Today's hearing is going to focus on the Free Choice of Provider Act, which was filed this legislative session by Representative Ana Maria Ramos and Senator Sarah Eckhardt, who are both former Planned Parenthood patients. The Free Choice of Provider Act will allow trusted community healthcare providers like Planned Parenthood to participate in funding and programming to ensure that essential reproductive healthcare is more accessible for tens of thousands of Texans, including people with low incomes, women, and people of color. This is a historic bill that the People's Committee is here to uplift. Since we know the bill unfortunately won't get a hearing in the Texas legislature, this is the hearing we would want to have. Today, April 1st, actually marks the 10-year anniversary of when the Texas House passed the most devastating legislation to date, which slashed family planning services in the state by 2/3, from $111 million to $37.9 million for the 2-year period. A move that resulted in 82 clinics, that's 1 in 4 clinics, closing across the state. After the funding cuts went into effect, Texas's family planning organizations served 54% fewer clients compared to the previous year. To get us started, I'm proud to introduce fellow People's Committee member Soraya Santos, a former Planned Parenthood patient and current community organizer in Dallas.
Thank you so much, Mireya. I am so proud to be here and share my support for the Free Choice of Provider Act. I am the youngest daughter of 5. My mother is an immigrant from Mexico who came to the United States, leaving her 4 daughters behind, the youngest of who was still being breastfed. She was determined to build a better life for them, and she did, bringing them to the US 5 years later. I was born 10 years after my mother came to the US, making me the only American born in the family. My sisters all had their children as teenagers, so I was raised with my nieces and nephews. As a low-income Latina, I felt like the healthcare system treated me like a farm animal, being herded from room to room with dozens of other people of color, waiting for undetermined amounts of time until I could finally see a doctor or a nurse. You have to understand, I thought this was what healthcare was. The thought of a healthcare professional listening to me, asking how I felt or anyone caring about the quality of my healthcare was alien to me. When I went to high school, I went to a Planned Parenthood health center in Dallas because I heard that they had free condoms. I was shocked to be greeted with compassionate care with health experts who helped me make informed decisions and provided the education I needed to stay healthy. I felt empowered. It was so important that my Planned Parenthood Health Center provided a sliding scale payment option, meaning all of my visits were free or very low cost. This was vital for me at the time. When I was a college student at UT, I received birth control, STD testing, and information so that I could stay on the path to college graduation. In my 20s, Planned Parenthood helped me understand that my family history of breast cancer meant that I should begin clinical breast exams and mammograms earlier in life to stay safe. When I was 22, I moved to Colorado. I was young, broke, and waiting tables, far away from my community and any family. I suspected I was pregnant, and Planned Parenthood was the first name I knew I could trust, even so far from home. I was so scared, and the immediate sense of safety I felt walking into that health center was such a great relief. It felt like being home. The clinic confirmed I was pregnant and immediately began to provide me with maternal care resources, including setting me up for a sonogram, follow-up, and prenatal vitamins. Planned Parenthood has been there for me for over 25 years throughout every stage of my life. With my own life experiences, I was driven to advocate for reproductive health and rights, and now I'm working my dream job as a Planned Parenthood community organizer in North Texas. At my job, I help community members fight for our health and our rights, all while building the power of our movement across the state of Texas. This is more than a job for me. I fight for Planned Parenthood patients in health centers every day because Planned Parenthood changed my life for the better. I believe deep down in my soul that everybody deserves access to affordable, high quality, non-judgmental care. Now I'd like to introduce Representative Ana Marie Ramos, who represents parts of Dallas County. Representative Ramos filed the Free Choice of Provider Act in the Texas House, HB 3825. Representative Ramos is a Planned Parenthood champion and a former patient. Representative Ramos, can you tell us how your personal experiences influenced your decision to file this bill?
Thank you, Planned Parenthood, for the opportunity to lay out HB 3825, relating to expanding access to women's health care services and family planning services by removing restrictions on the participation of certain healthcare providers. Our bill amends Government Code Section 531.0025 entitled Restrictions on Awards to Family Planning and Service Providers, which places restrictions on reproductive health care. Current code limits healthcare centers that provide comprehensive reproductive health care from participating in the Healthy Texas Women program. Currently, local governments cannot enter into partnerships with healthcare providers, which takes away the city's autonomy to make the decision that would benefit the community. The Free Choice of Provider Act would repeal politically driven funding restrictions in order to make affordable reproductive health care more accessible for tens of thousands of Texans. Those expected to benefit most are people with low income, women, and people of color. In 2018 in Texas, 23% of women were uninsured. Of those, 38% of them were Latinos and 27% were African American. Over 80 healthcare clinics have been closed because of efforts to shut down local healthcare providers by state leadership. This has cut off thousands of women from accessing cancer screenings, birth control, and other vital reproductive health care. Tens of thousands of Texans have lost access to care in the state, with the highest uninsured rate among women of reproductive age. Texas has one of the highest rates of maternal mortality in the United States, which disproportionately affects women of color, especially Black women. I myself have benefited from some of these healthcare providers that have been restricted due to this draconian bill. And so with that, I thank you, Chairwoman and committee members, for your time. I appreciate your favorable consideration. And with that, I close.
Thank you so much, Representative Ramos. Now I'd like to introduce my state senator, Senator Sarah Eckhardt, who filed the Senate companion bill. Senator Eckhardt is a Planned Parenthood champion and has advocated for reproductive health and rights throughout her entire public career. Senator Eckhardt, can you tell us why this bill is so critical right now?
Hi, I'm Senator Sarah Eckhardt, and I have been a patient of Planned Parenthood, as well as taking friends and family to Planned Parenthood in 3 different states in the United States: New York, Illinois, and in Texas. I have gone and I have taken sisters, friends. I have contributed to Planned Parenthood. I've marched with Planned Parenthood, as well as other full spectrum reproductive health care providers in the state of Texas. And I am so grateful that even in this incredibly toxic environment, Planned Parenthood and clinics like them stay with us, stay with the women of Texas. I'm very, very grateful. I'm going to tell you, we're not in a good place. And I know that I'm preaching to the choir when I say this. The state politicizes reproductive health care, and low-income people and women, people of color particularly, lose access. We already know what happens when politicians dismantle these sorts of programs. It hits people really hard. It hits families hard. We know that we have the lowest insurance rate in the entire United States, and it's even gotten worse during COVID-19. We may be as high as 1/3 of Texans without healthcare coverage, and that's hits women particularly hard, and women of color particularly hard. And I just went through the last 3 days, or last 2 days in any case, dealing with yet another legislative session that just keeps pounding the nail, reducing access to reproductive health care. We saw a raft of bills, and all of them passed the Texas Senate. that seek to delay and dissuade a woman from her right to choose by isolating her from the people that she most trusts, by isolating her from her physician and from her friends, threatening her friends and her physician with civil and criminal penalties for assisting her in her right to choose, and also threatening her physician with financial and professional ruin if he or she assists her with her right to choose. There were also a number of bills that created additional hurdles intended to dissuade a woman from her right to choose through empty promises of services that don't exist, services that she probably doesn't qualify for, services that she may not even want or need. We know that the state of Texas has an abysmal record for assisting families with housing, with childcare, with educational opportunities, with professional development. And yet all of these things would be promised as a way to dissuade a woman or delay a woman in her right to choose. So here's the good news. We do have bills that would restore funding to Planned Parenthood. We have the Free Choice of Provider Act that would repeal politically driven funding restrictions in order to make affordable reproductive health care more accessible for tens of thousands of Texans, especially people with low income, women and people of color. This is so important for us to keep up the good fight. So call your legislator, email your legislator, show up at rallies, contribute to Planned Parenthood. I came home Monday night so deflated, so upset, and I sat down at the kitchen table and I talked to my 18-year-old daughter and I said, I failed you, baby girl. The state of Texas is criminalizing being a woman. And maybe I should encourage you to move out of the state. And her response was, I love Texas. I'm not going to abandon Texas. Instead, I'm going to open up my computer and I'm going to go to the Planned Parenthood website and I'm going to find what my next opportunity is to get involved. And I'm going to tell all of my other 18-year-old, 19-year-old girlfriends that we need to step up to the plate. And so that's the good news. We've got good bills for you all to advocate for, and we've got tremendous advocates out in the field. So let's stay at it, y'all. We're not going to abandon the field. This is too important. Let's stand together and make sure that we restore funding for full spectrum reproductive health care for every Texan. Thank you, Planned Parenthood.
Now I'd like to introduce Senator Carol Alvarado, who represents parts of Harris County in the Texas Senate. Senator Alvarado supports the Free Choice of Provider Act in the Texas Senate. Senator Alvarado is a longtime Planned Parenthood champion and a former member of the Planned Parenthood Gulf Coast Board. Senator Alvarado, can you tell us about your support for reproductive health care and why you support this bill?
Hi, my name is Carol Alvarado, and I represent Texas Senate District 6. As a former Planned Parenthood board member and volunteer, I know how vital the health services provided by Planned Parenthood are to Texans. During my career as a public servant, I've been a champion for measures that increase access to affordable, quality health care. The Free Choice Provider Act by Representative Ramos and Senator Eckhart repeals prohibitions keeping local governments from contracting with proven medical providers such as Planned Parenthood. These limitations severely reduce access to healthcare, including breast cancer and cervical cancer screenings, HIV education, testing, and access to contraception. Attacks on Texas healthcare providers have consequences. Texas has the highest teen pregnancy rate among people of color, one of the highest death rates from cervical cancer, and the highest uninsured rate in the entire nation. Ultimately, these laws reduce access to sound, evidence-based reproductive health care and increase the number of unintended pregnancies, which is the opposite of their intended effect. Passing House Bill 3825 and Senate Bill 1722 to repeal these misguided laws will increase access to care improve public health, and increase women's choice of providers. What's clear from 10 years of misguided policy borrowing state funds from Planned Parenthood is that the policy does not work. I support the Free Choice Provider Act and support increasing access to care for all Texas women.
My name is Laura Gorski, and I'm also a former Planned Parenthood patient and a member of the People's Committee. When I moved to Austin in 2017, I needed access to reproductive health care. I wasn't familiar with the city, but I knew I could go to a Planned Parenthood to get access to quick and judgment-free care. I'm lucky that I was able to live in a city with Planned Parenthood and that I was able to access reproductive health care. I want to take a little minute to tell you a little bit about what the Free Choice of Provider Act would do. This bill would repeal limitations that the state legislature has put onto federal, state, and local family planning funding for reproductive health care providers. It would allow for health centers that provide comprehensive reproductive health care to participate in the joint federal-state Healthy Texas Women program. And it would also repeal a law that prohibits local governments from partnering with trusted community healthcare providers, such as Planned Parenthood. To help us better understand the history of funding restrictions and the people in our state that have been hurt the most, we are going to hear testimony from Stacy Pogue, Senior Policy Analyst on the Health and Wellness team at Every Texan.
Hi, I'm Stacy Pogue, a Senior Policy Analyst at Every Texan. And at Every Texan, we believe that Texans of all backgrounds should be able to thrive, and that one key component of that is access to affordable healthcare. I've been working on or around or for our state family planning program since 2007. 10 years ago, the Texas legislature and our state leadership placed a very dangerous bet that they could pull the foundation out of our women's healthcare programs, out of our family planning programs, and yet somehow maintain access to healthcare. And the premise of that bet was outlandish from the very beginning. But now we have 10 years of data and analysis that provide overwhelming evidence that this was a failed experiment. And it's Texans who've paid the price, right? They've lost access to healthcare services. They've been told they can't see the provider of their choice. They've had to pay more or wait longer for services. They've been unable to get the birth control method of their choice. And because of all of those things, their healthcare outcomes have been worse. So here are the actions in a nutshell over the last 10 years. First, 10 years ago, the legislature gutted funding for our family planning program. Then they redirected the little bit of money left away from the specialized family planning clinics, and then finally barred certain providers from participating at all in serving low-income women if they provided the full range of reproductive health care, including abortion. Planned Parenthood was, of course, the target here, but Planned Parenthood wasn't just a provider in our women's healthcare programs. It was the single largest provider. It created the foundation, and it served 40% of all clients in our family planning programs. The initial wave of harm was sweeping. 1/4 of all the clinics closed, others reduced their hours or started charging for services, and the number of women served plummeted. And we saw years of declining services and fewer women getting health care until we entered this phase a few years ago of one step forward and one step back. This is where the state would start applying kind of patches and duct tape around the edges of our women's healthcare programs without rebuilding that foundation. So what that looks like is reinvesting some more money, but putting it in this very new and very short-lived program that didn't have providers in it that focused on family planning services, right? Or reinvest the money, but give a surprisingly large amount of it to the Heidi Group, which was a completely untested and unqualified network of providers that had no way to deliver on the promises it made to the state. And of course it didn't, and the state had to claw the money back. And so here we are, 10 years later. We are paying more, we are investing more in our women's healthcare programs now, more than we ever have, and that point's clear. But we're not getting a good return on our investment. We're not seeing as many women, and there's not as much healthcare being delivered. The state data that we have available on women getting services show that the number is lower now than it was 10 years ago. And the data on women getting services isn't great because the state's changed the way it counts, but we know it's not a good investment, and we know we need to do better on spending our healthcare dollars. So there's two things that we should do and can do this session to move forward. First, we need to expand Medicaid. It is the single most meaningful step we can take to increase access to healthcare for low-income Texans and people who are just locked out of coverage today. And this is disproportionately Latinx and Black Texans. Not only would Medicaid expansion give them access to family planning, it's healthcare insurance, right? It doesn't stop at family planning. It covers all of your healthcare needs for your full body. And then the second thing we need to do is, because we will always need strong and robust family planning programs, even with Medicaid expansion, is we need to build that foundation back and the infrastructure for good family planning programs. And the way we do that is we make sure we don't have arbitrary provider restrictions, and then we direct our public dollars to the specialized family planning clinics and the other providers that have high capacity and high quality to give the services we need. And Planned Parenthood's one of those really fundamental foundational providers that needs to be in that program.
My name is Rune, and I'm a Latinx queer trans sex worker and sex educator from the Rio Grande Valley. I'm glad to be here today as part of the People's Committee. I've seen firsthand the damage that abstinence-oriented sex education inflicts on communities of color with high rates of poverty. I've also seen how my local Planned Parenthood Health Center addressed these serious issues by providing a judgment-free space to empower their patients through education and accessible healthcare, which in turn has inspired my own journey as an activist and feminist. Because I was raised in a conservative Catholic home, I entered college with scant knowledge of reproductive health and bodily autonomy. And what I did know was scavenged from 90s teen help books found in my high school library. Planned Parenthood's student group on my campus was one of the first places I felt safe to ask questions and admit I was a sexually active adult in need of some healthcare. I had no idea a broke college student could go somewhere for annual exams and birth control. Voices for Planned Parenthood, also known as Vox, helped me enroll in state programs that completely covered the costs. Tabling local events brought me face-to-face with the people of the RGV, and surprise, so many others were also in need of these services. They shared their concerns about affording to raise another child in low-income households, how some had left school due to an unplanned pregnancy. It opened my eyes to how accessible reproductive health care affects the lives of vulnerable communities. I continued to advocate for Planned Parenthood even after I left school. Because my family had normalized abusive behavior growing up, I unfortunately found myself in relationships that were also violent and unhealthy. After leaving an abusive marriage, I began to reignite the parts of myself I had dimmed for my ex-husband's comfort, including with the help of my best friends, starting a home for LGBTQ+ youth who found themselves also needing community after facing rejection from their families. Through this, I was able to interact directly with queer folks 18 to 25 and help them negotiate complex life situations. Trans folks asking about birth control, sex workers asking where to be tested, and heartbreakingly often we were asked to assist domestic violence and sexual assault survivors. When the home unfortunately shut down, I maintained that level of availability for my community and carried the knowledge and self-reliance I'd gained from that time in my life. For many of the questions I receive about services and resources, I can just direct folks to Planned Parenthood and honestly share how Planned Parenthood was there for me in similar circumstances when I was younger. Though there is no longer a Planned Parenthood Health Center in McAllen, I plan yearly checkups with friends and coworkers to carpool to our nearest health center. And sometimes I get this random thought of how happy I am to be alive, how there is no one in my life who would hurt me. And I can trace this directly to the day I stood up for myself, the beginning of an era of empowerment, courage, and compassion. Now we're going to hear testimony from Jeffrey Hans, CEO of Planned Parenthood South Texas.
Hola, buena gente, luchadores, fighting for health, for science, para familia y comunidad, fighting for our lives. My name is Jeffrey Hans, and I work at Planned Parenthood South Texas. And today I implore you to raise your strong voice in support of the Free Choice of Provider Act. And here's why. A wise woman said this to me years ago. She says, I am a sucker for irresistibly sensible ideas. This bill is irresistibly sensible. Others will tell you this bill is about Planned Parenthood, and therefore you can predict the supporters and the detractors before you even read the bill. You know what? So go tell them to go read the bill. Because this bill is actually about effectiveness and productivity. in government contracting. See, the government hires businesses and organizations to do a lot of the things it needs, like everything from building roads to educating students and, yes, to providing healthcare. Texas doesn't do these things directly itself. It hires others to do these things on behalf of the government. And when making those hiring decisions, government should select the very best organizations based on productivity and effectiveness. Where I work at Planned Parenthood South Texas, we have a history of effectiveness, quality, productivity. And yet Texas will not hire us to deliver family planning services. Why not? After all, we've been doing this for 82 years and have demonstrated excellence. And that should be what drives decisions about where Texas healthcare dollars go. But Texas doesn't like that we tell our patients the truth about their bodies, their healthcare, and about abortion care. Texas doesn't like that we answer our patients' questions when they ask about abortion. This truth as the basis for our exclusion is ridiculous. People who need family planning care, which the state has already agreed to help pay for, they can't come to Planned Parenthood South Texas because some other patients that day, or on another day, or at another site even, might be asking about abortion or might be having an abortion. Let's remember who this really hurts, because it's not me and it's not Planned Parenthood as an organization. These ridiculous rules and laws hurt the people I care about, the people Planned Parenthood South Texas cares for or could care for if the state would change this situation. Disproportionately, this hurts people with low incomes because they rely on state-funded programs for their healthcare. And the data shows this includes too often Black and Latinx people who experience health inequities due to structural racism, implicit bias, and the economic disadvantage created by that oppression, historically and still today. So let's stand up and fight for that which is irresistibly sensible, wise, intelligent, and in the end, compassionate. Tell your elected representatives to support the Free Choice of Provider Act. And if they resist, ask them to tell you why they won't.
Hi, my name is Aubrey, and I'm a Planned Parenthood patient advocate and People's Committee member, and I live in Amarillo, Texas. My story begins in Lubbock, Texas in 2015. I was a student at Texas Tech University and in my first serious relationship. I had big plans for my future, so I decided to explore some long-term birth control options. I knew there wasn't a local Planned Parenthood clinic where I lived. In fact, I had attended the rallies in Austin against HB2, the Texas Omnibus Abortion Bill, in 2013. I understood what was at stake, seeing that these clinics were closing, but I just never thought that I would face that reality myself. And after no luck at other low-cost clinics in the area, I decided to go to our student health center. At the student health center, the doctor told me I had a blood clotting disorder, something that I had never been told before or since about my health, and that I would have to get clearance through a number of doctors before she would even begin to think about prescribing me birth control. I became upset and teared up after being told that I was too unhealthy to be put on birth control. Here I was, 20 years old, trying to take control of my health care, and yet in that moment, I had never felt more powerless. The doctor turned her head towards me and looked at me incredulously. She asked why I was crying and if I was really in that big of a hurry to become sexually active. And that felt like a slap in the face. Suddenly, I became aware that this was not the experience I wanted or deserved, and I was seeking non-judgmental healthcare, but yet I was being let down and not supported. I wanted to trust my doctor and was ultimately judged for deciding to protect my future. I ended up having to drive to Fort Worth, nearly 5 hours away, to my closest Planned Parenthood clinic. just to get the care I needed. I knew very quickly that I was really lucky to have the means and support to make that trip when a lot of other people don't share that same privilege. At Planned Parenthood, I explained what I was looking for and got exactly what I needed. I wasn't met with judgmental questions or odd stares. The doctor at Planned Parenthood even understood that I needed the implant put in the same day because I wouldn't be able to come back for a follow-up. I would be heading back to West Texas, a reproductive healthcare desert. And the doctor there at Planned Parenthood helped me get the care I needed. Since then, I've been working with Planned Parenthood Greater Texas and Planned Parenthood Texas folks to raise awareness about the lack of access to reproductive health care in Texas, but particularly in West Texas. Now we're going to hear testimony from Cami Jeffrey, the CEO at Everybody Texas. Everybody Texas is the only statewide organization that administers Title X funding to Texas providers. And just so we're clear, the Title X Family Planning Program, the federal grant program for low-income patients to receive family planning and reproductive health services.
Thank you to Planned Parenthood Texas Votes for organizing the People's Hearing and inviting me to share a few words today from my home in Austin, Texas. I'm here representing Everybody Texas, an organization that works to ensure that every person in Texas can access safe, unbiased, high-quality sexual and reproductive health care, regardless of income or identity. We do that in part by administering federal Title X family planning funds, supporting a network of more than 175 clinics across Texas that serve nearly 180,000 people each year. Together, we've worked really hard to increase access to birth control in a state where nearly 2 million women are in need of publicly funded family planning care. But we've had to do that in the face of serious political interference at the hands of the Texas legislature. What has happened in Texas over the last decade serves as a cautionary tale of the deeply harmful consequences that can result when policymakers target particular family planning providers, undermining freedom of choice. In 2011, state lawmakers made a series of funding and policy decisions that ultimately resulted in 82 family planning clinics, 1 out of every 4 in our state, closing or reducing hours, restricting access to critical reproductive health services across the state. The intended target was family planning providers that also provide abortion services or affiliate with abortion service providers, Planned Parenthood specifically. But the consequences reached much further. 2/3 of the clinics impacted were family planning providers that had no affiliation with abortion service providers, and tens of thousands of Texans lost access to services. The evidence from Texas is overwhelmingly clear. Prohibiting people from choosing where they receive healthcare services because some family planning providers also provide abortion services reduces access to healthcare and places the health of Texans at risk. And once lost, access is difficult or impossible to reestablish. Although significant funding has been invested to bolster the weakened family planning safety net over the last decade, state-funded programs still are not serving as many individuals today as they did in 2011. The Free Choice of Provider Act, filed by Representative Ramos and Senator Eckhart, will help address one of the most significant harms to Texas's family planning safety net over the last decade, undermining free choice of provider. On behalf of Everybody Texas and the sexual and reproductive healthcare providers that we support, we thank Representative Ramos and Senator Eckhart for their leadership on this issue and strongly support efforts to ensure that the most qualified providers are prioritized for participation in Texas's safety net healthcare programs. All Texans should have the freedom to choose where they receive sexual and reproductive healthcare services, regardless of their income, identity, or circumstances.
Hi, I'm Amy. My pronouns are she and her, and I'm a Planned Parenthood patient advocate and People's Committee member. I live in San Marcos. I've been a patient at the Planned Parenthood 7th Street Clinic in Austin for over a decade. I can trust Planned Parenthood for affordable, reliable, and compassionate healthcare. When I first visited the Austin clinic, I didn't have health insurance, and I was working part-time at a low-paying retail job. Planned Parenthood was a name I recognized and trusted, both because I visited them in Dallas when I was younger, my parents were paying for my healthcare, and because of their national reputation for providing low-cost and sometimes no-cost preventive reproductive healthcare, including Pap tests and STI testing. After that first visit at the Austin Clinic, my Pap test showed precancerous cells. When I got the call from Wanda, a health clinic staff member, I was extremely upset. I didn't know what that meant and I wasn't expecting it. I was scared I would have cervical cancer and not be able to have it treated without health insurance. Wanda explained that the medical access program that Central Health here in Travis County offers uninsured people who meet certain income requirements. I was able to send the necessary documents and application in with help from the staff at the 7th Street Clinic, and MAP covered the cost of a colposcopy, which showed that I hadn't yet developed cancer. I've since learned that my condition, which is caused by HPV, is very common, and that cervical cancer is one of the most common forms of cancer, and also one of the most preventable because of how slowly it develops. Pelvic exams and Pap tests like the one I got at the 7th Street Clinic prevent cervical cancer. Without them, people die. Over a third of people diagnosed with cervical cancer die each year. It was infuriating to me to come to the clinic to get life-saving treatment and then to walk outside and see some man holding up a sign saying Planned Parenthood kills babies. The truth is Planned Parenthood saves lives. I decided to become a volunteer with Planned Parenthood Greater Texas out of gratitude for the help they gave me and the kindness that they showed me. It's been a wonderful experience over the past decade. I've made great friends and learned so much. Even though I now have a job that I love and private health insurance through my husband's employer, private insurance still has significant obstacles to overcome, and Planned Parenthood is still the most convenient, affordable, and reliable choice for reproductive health care for me. A few years ago, I went back to the 7th Street Clinic for another Pap smear. After years of being in a situation of monitoring my health, I worried that the uncertainty would never end. Then I got another call from Wanda, this time letting me know that those precancerous cells were finally gone. I am tired of feeling like a pawn in other people's games. Our health and peace of mind shouldn't be legislated away so that far-right lawmakers further their political agenda. Access to healthcare saves lives. Don't take it away from the state's most vulnerable communities. I was only able to receive healthcare all those years ago because Planned Parenthood was a part of the Women's Health Program, something the Texas government has legislated out of existence since then. I don't know what I would have done if I had found myself in that same situation today. Thank you to those of you who are able to share your personal stories about why reproductive health matters. I'm going to share a few of those stories right now. From Crystal C. As a teen growing up with a single mother with little means, she wanted to ensure that my reproductive health went beyond just contraception, and Planned Parenthood was the only place that provided me services that were affordable for my mother at that time. Planned Parenthood provided me access to education and services around reproductive rights and services, mammograms, and being that I come from a family of women who have survived as well as succumbed to cancer, education on how to get preventive services was so valuable to me. I am a woman of color, and we have not always been given the valued service or truth when it comes to working with private doctors. So I am truly grateful to Planned Parenthood for what it has taught me and how they treated me, like a woman and a human. This next story is from Lindsay C. In late high school, I desperately wanted to get on birth control to help practice safe sexual practices. I could not communicate this need to my parents as they would have responded in anger and punishment. However, if there had been a Planned Parenthood within an hour of me, I would have been able to avoid the paranoia of purchasing Plan B from CVS and Secret. In college, a Planned Parenthood would have helped me and many of my friends to be able to obtain affordable health screenings like Pap smears and STD testing. Thank you, Crystal and Lindsay, for sharing your stories. Your stories are powerful. Please continue to share why reproductive health and choosing the provider you know and trust is so important. Please continue to share your stories on social using the hashtags #FreeChoice and #TextSledge.
Thank you so much to our incredible People's Committee for being here and to everyone who participated this evening. Let's make sure members of the Texas Legislature know that we are going to keep fighting for our health and for our rights. A great way to get started is to become a grassroots supporter of the Free Choice of Provider Act. We're going to drop in the chat how you can do this. If you want to meet with your elected officials in the Texas House and Senate, sign up for Planned Parenthood Texas's Advocacy Week of Action. It's next week and you won't want to miss it. I'll be there and I look forward to hearing from all of y'all. Until then, that's it for our People's Hearing. Again, thank you everyone who participated and all of you who joined us. We deserve to have our voices heard. We deserve the right to speak up for what we believe in. Together, we are building power as a movement for the future and for our next generation. The more of us in the fight, the stronger we are. This fight is not easy, but I am so honored to be in it with all of you. Thank you and good night.